If you're watching this video, it might be because you have suffered a miscarriage, and if that is the case, my heart goes out to you. Miscarriage is one of the most traumatic things which can happen to a woman in my experience. Those are difficult times, and I can understand your pain, not only as a doctor, but also as a patient. It's very close to my heart because I have personally gone through one miscarriage in my mid 30s, and I could then fix it from the root cause to have a healthy pregnancy in my 40s. And I have helped hundreds of women create the healthiest possible babies, even if they had recurrent multiple miscarriages in the past. And I'm so happy and proud to share that our success rate in recurrent miscarriages is over 95%. I will go on to say it is 100%. And I am here to tell you that miscarriages can be completely prevented and avoided if you are willing to do the work and if you are willing to look at the root cause of the problem. And of course, fix it from the root cause, just like me and hundreds of my clients have done. I have had so many conversations with so many women who had miscarriages, sometimes multiple, and nothing much was done to fix the root cause of the problem. There was not even talk about the root cause, and they were told to again try after a few months and then come back. And then they have another miscarriage or some other complication because root cause was never addressed. So if you are suffering from this kind of traumatic situation, this video is for you. Hi, I'm Dr. Disha MD. I'm your holistic gynecologist and natural fertility expert. So in this video, I'll be talking about possible causes that you want to look at to avoid having another miscarriage, and I will also share about the tests that I ask for when working with someone directly as a part of my online fertility coaching program. What you're about to learn comes from my over 20 years of experience as a holistic gynecologist and fertility coach, helping couples from all over the globe achieve natural healthy pregnancies and babies of their dreams. So if you are afraid of having another miscarriage and want to do everything possible to avoid it, you have come to the right place. Having a miscarriage, just one, is super difficult and challenging, let alone having repeated or multiple miscarriages, which is how we diagnose someone with a recurrent pregnancy loss. This means that you have had multiple miscarriages or losses, and then we diagnose you as RPL, and guideline says that you have to wait till 3 miscarriages to diagnose someone as recurrent pregnancy loss and then start investigating. But I do not agree with that. I have gone through one miscarriage and it was so painful and so traumatic, and what I have seen is once you fix the root cause, you can completely prevent and avoid the second miscarriage. So I like to investigate after the first miscarriage and fix it from the root cause so that you don't have to go through that pain again and again. In fact, if you prepare your body for a healthy pregnancy, the way I teach you, you can completely prevent even the first miscarriage, avoid all the complications of pregnancy, and create the healthiest possible baby of your dreams. And that would be the ideal situation. Also, my methods help you to create the healthiest possible baby because even if there was a genetic problem in the first place in the conceptus, with the science of epigenetics, you can actually influence the genetic expression, the way that your genes express themselves. And I have seen a lot of success with my clients, and that's what I'm here to share with you today. So in this video, I'll be talking about possible causes that you want to look at to avoid having another miscarriage, and I will also share about the tests that I ask for when working with someone directly as a part of my online fertility coaching program. What you're about to learn comes from my over 20 years of experience as a holistic gynecologist and fertility coach, helping couples from all over the globe achieve natural healthy pregnancies and babies of their dreams. So if you are afraid of having another miscarriage and want to do everything possible to avoid it, you have come to the right place. Having a miscarriage, just one, is super difficult and challenging, let alone having repeated or multiple miscarriages, which is how we diagnose someone with a recurrent pregnancy loss. This means that you have had multiple miscarriages or losses, and then we diagnose you as RPL. And guideline says that you have to wait till 3 miscarriages to diagnose someone as recurrent pregnancy loss and then start investigating. But I do not agree with that. I have gone through 1 miscarriage and it was so painful and so traumatic. And what I have seen is once you fix the root cause, you can completely prevent and avoid the second miscarriage. So I like to investigate after the first miscarriage and fix it from the root cause so that you don't have to go through that pain again and again. In fact, if you prepare your body for a healthy pregnancy, the way I teach you, you can completely prevent even the first miscarriage, avoid all the complications of pregnancy, and create the healthiest possible baby of your dreams. And that would be the ideal situation. Also, my methods help you to create the healthiest possible baby because even if there was a genetic problem in the first place in the conceptus, with the science of epigenetics, you can actually influence the genetic expression, the way that your genes express themselves. And I have seen a lot of success with my clients, and that's what I'm here to share with you today. In this video, I really want to focus on the top main causes of miscarriage, and there's a lot you can do to prevent another miscarriage. The first cause is genetics. Now, this is one of that most doctors, most gynecologists, and most reproductive endocrinologists believe is the cause of miscarriage or recurrent pregnancy loss. It's fairly common, right? Now, this does happen fairly regularly and unfortunately tends to happen more frequently as you age. But it doesn't mean that all miscarriages are a result of some sort of genetic abnormality or chromosomal abnormality that would be passed by either one or both partners in the relationship. Yes, this can happen. Yes, it happens regularly. It doesn't mean that you should stop trying, and it doesn't mean that every loss is a result of genetics, even though that's what you might have been taught. One test that you can help rule out this kind of a problem is what's called a karyotyping test. You can do this before you start trying, or even if you have had some kind of a loss, you can do it at that point as well. Now, this is something you would ask your gynecologist or reproductive endocrinologist to run. Now, there are different potential genetic tests that you can run. Certainly, if you're doing IVF and you want to do genetic testing, you can do PGTA testing on the embryo. Once the embryo is already developed, you can do that. Now, that test, however, is very limited in its scope, and at the end, we cannot test for every chromosomal abnormality. So there is still some inherent risk even with these tests, and that is why personally I'm not a huge fan of running these genetic tests, and I believe in making the body healthy, making the egg healthy, making the sperm healthy. And once we do that, we know the science has proven, epigenetics has shown us that you can even change your genetic expression and you are not a victim to your genes. Number 2, the second potential cause of miscarriage, also fairly common, is some kind of a hormone imbalance. Now, this can happen due to many hormone imbalances, but for the purpose of this video, let me talk about the 2 main hormonal imbalances that cause miscarriages. The first one is progesterone deficiency. Your progesterone, the progestational hormone in the luteal phase, in the second half of the cycle, should be higher. Now, we want to see it at least around 15, but if you have a positive pregnancy test, we prefer to see it at 20 or higher. Now, if your levels are below that, then typically you're not creating enough progesterone, and one potential solution to this problem is to supplement with progesterone. Now, you would only really want to do this in your luteal phase. Now, if it is a repeated problem, then you can even start to take progesterone after your ovulation. Another hormonal cause potentially for a miscarriage is a thyroid problem, such as hypothyroidism when your thyroid is too sluggish, or even hyperthyroidism. Again, thyroid issues are very close to my heart as I've personally suffered from it and recovered from it and helped hundreds of women balance their thyroids naturally. Thyroid disease can cause difficulty conceiving and potentially make it much harder to carry a pregnancy to term. So, those are the two main hormonal issues we commonly see with miscarriages. I'm not saying there aren't others, I'm just saying that those are the two primary ones that often cause miscarriages. Okay, so the third main cause of miscarriage is little more challenging, and these definitely require more in-depth testing, which many gynecologists and endocrinologists don't really want to do, or maybe they don't find value in that. But I am a super duper fan of testing these causes, and they are autoimmune issues. Again, very close to my heart because I personally suffered from Hashimoto thyroiditis, which is an autoimmune form of thyroid disease, and I managed to put it in permanent remission, not only for myself, but for many of my clients. Now, on top of that list of common autoimmune issues is something we discussed in the last point: thyroid problems and thyroid disease. This condition takes hypothyroidism to the next level, and it's called Hashimoto thyroiditis or Hashimoto disease, which is hypothyroidism with an added autoimmune component. Hashimoto disease is fairly common today. About 60% of all women with hypothyroidism also have, or over a period of time, develop Hashimoto disease, which can be a very common cause of miscarriage. Other common autoimmune conditions that can contribute to miscarriage include Sjogren's syndrome, rheumatoid arthritis, lupus, natural killer cell activity, and these conditions are fairly common but not often checked. One general test that you can run is called ANA, anti-nuclear antibody. This general test for autoimmune issues doesn't specifically tell you where the issue is, but it does tell you if you have an autoimmune component going on. Another important autoimmune condition is antiphospholipid antibody syndrome, APLA, which is kind of a bridge between the autoimmune and the blood clotting issues. And this syndrome should also be ruled out when examining potential causes of miscarriages. And this one I have had a lot of experience with and a lot of success with. And many of my clients with APLA have carried the pregnancy to term. All right. So next very important reason for miscarriage can be blood clotting. What's going on here is with autoimmune issues, the body can become hypersensitive, seeing the baby as a foreign object and trying to reject it. With blood clotting issues, the clots can form as the baby implants, hindering its development. This issue may cause chemical pregnancies or implantation issues where a pregnancy starts but it can't fully grow, it can't fully develop. Common blood clotting disorders include MTHFR, a genetic methylation disorder that makes it difficult to convert folic acid into folate, as well as some others like factor V lead-in mutation, factor VIII, protein C and protein S deficiency. Another common issue we see today is PAI, which is plasminogen activator inhibitor. So there are many blood clotting disorders, and if you have a family history of such issue, you may already be working with a hematologist. What I've seen in my experience that integrative holistic approach really helps here, and many of my clients with APLA have gotten great success with healthy pregnancies, and they were able to carry the baby to term, full 9 months. And the last cause of miscarriage is some kind of a uterine abnormality or implantation issue, something to do with the inner lining of the uterus, the uterine environment, endometrium. And this can be tested with EMA test or ELISE test or even endometrial biopsy. Now, lots of technical details in this video, so hopefully you are staying with me. If not, just watch it again and take some notes. It's all okay. And now I don't want to imply that all miscarriages are due to female factor, although in our patriarchal society, infertility and miscarriages are generally considered to be a problem of women. The truth is that 50% of all miscarriages are contributed to by the male partner. And to evaluate that one, we need to do a regular standard semen analysis. But number two, we also want to do a DNA fragmentation test. The higher the fragmentation, the more likely male is a contributing reason for a loss. And the lower the number, the better it is. I mean, we want to see the number as low as possible, preferably under 20, and the lower the fragmentation, the less likely there is male partner contribution to the loss. But we do want to evaluate that so that we know what to do next. Now, as we are talking about the causes for miscarriages, we do not want to ignore the male. We want to make sure that we are evaluating everything possible and not leaving any stone unturned. To make sure that you remain hopeful, here's an amazing real life case study from one of the members of my online fertility coaching program, Pooja Jain, who could become a mom even after 3 miscarriages. Now, this beautiful lady, Pooja, never thought that it could be so difficult to get pregnant and stay pregnant. When she came to me, she had already suffered from 2 miscarriages and she was pregnant with the third baby who had also miscarried. So when Pooja came to me, the baby's heartbeat had already stopped and I couldn't do much for her except to help her remove that unhealthy pregnancy from her body. And no one would have thought that such a young, beautiful lady, apparently healthy lady, can have so much difficulty getting pregnant and even staying pregnant. Pooja had been trying for so many years without success, and the third pregnancy had also miscarried by the time she found me. Many years of struggle and a lot of frustration, and unfortunately, Pooja's story is not unique. So many women who join my online fertility coaching program have similar stories. I want you all to read her story in her own words, and I will post it down below because I think it can give you hope. In Pooja's case, there was underlying autoimmunity which was never diagnosed, never treated, and she worked with me in my online autoimmune remission program for 1 year. And of course, the full credit goes to her. She did all the work diligently. She showed up on all the coaching calls, did all the work, and by the end of the program, she was a different person. No wonder, in a few months, she could conceive naturally and keep that pregnancy for full 9 months. In this picture she shared with me is from her baby shower in the 7th month of pregnancy, and look at her glow. She was looking good and feeling good throughout her pregnancy and postpartum period, and now Pooja is a mom of a super duper healthy baby. So before I wind up this video, I want to remind you that I am Dr. Disha MD, your holistic gynecologist and natural fertility expert, and this channel is dedicated to helping you to not only get pregnant but also keep that pregnancy and get the healthiest possible baby of your dreams using integrative, holistic, natural reproductive medicine to get the best results and fastest results in your fertility journey. I have been helping ambitious women all across the globe fix hormones and get pregnant naturally for over 20 years now. Pooja is just one of those who could get the results that she wanted, so I want to invite all of you who need a little more support, who want me as your personal coach to get the results that you deserve, to apply for my online fertility coaching program. All you have to do is to fill the form in the description below, and let's see if we are a good fit to work together. If you believe in changing your destiny and are interested in joining my online fertility coaching program, I want you to understand a little bit more about it. This program is not for everyone. It's a very high-touch program, and it's only for those who are action takers and are coachable. Everybody who joins this program gets a private one-on-one consultation directly with me to support you, and here we dive deep into your own specific root cause, review your full medical history, review all your investigations, and then I tell you where you are right now and if there is any additional testing required. And once I get all that information, then we are able to take that and create a customized, personalized plan for you. And it's a 360-degree comprehensive plan. The dietary changes, the lifestyle changes, the natural supplements, detoxification, how to correct your menstrual cycle, how to work with your period cycle, clearing mental emotional blocks, connecting with your feminine energy, stress management. We try not to leave any stone unturned, and this program is as comprehensive as it can get because we want you to get results and get them as quickly as possible. On follow up calls, we review your progress and then we make modifications as required, and so much more. Apply to qualify in the link below to see if we are a good fit for each other to work in the program. If you like this video, give me a thumbs up and share this message with any girlfriend who needs to hear this. Women are suffering and they are not getting the right information. Please subscribe to this channel so that more women can hear this message. And if, like Pooja, you need my help and want me as your fertility coach, remember to apply to qualify for my online fertility coaching program using the link in the description below. Drop your questions about miscarriages below, and if you want me to answer them. And until the next video, take very good care of yourself and your fertility.